Let's do it. Okay. My research was on money management and foods and nutrition courses and whether they would be beneficial to the Salvation Army. The lower socioeconomic residents of Morgan County lack enough food to last them through each month, which leads them to have to go find food at other places like the Salvation Army Food Bank, the Jacksonville Food Bank, and local churches that give food and things like that. In my literature review on the money management side, I found an article from Jacobs, and it discusses a chain reaction that happens. It says that the lack of educational mandates in schools have led to our children not getting the math skills that they need. So that leads to a lack of money management skills, which in turn leads to a financial crisis when they reach adulthood, which in turn leads to a lower socioeconomic community. Some surveys have been done in 1997 and in 98-99 surveys. It was shown that financial literacy is low among the citizens, that they actually have a 21 to a 23% bad math skills. In the literature, it describes financial resource programs, some of which are the All My Money program, which is available through the U of I Cooperative Extension. And it does have a small fee attached to it, which is $140, which I think is a very small amount considering the benefits that it would bring to the community for that particular agency. Another program is the Money Smart program, which is available through FDIC. It is actually a free program. And then there is also financial literacy that is available through NFCC. It is a network of over 1,400 networks that have free materials that are available to the public for different programs. Some testing has already been done on this in the Chicago area, where banks and agencies have had a cohort using these programs. The programs are roughly 5 to 10 weeks long, depending on what the banks and the agencies worked out together with themselves. There's also a homeless shelter in the Chicago area that implemented a money management program that's 8 weeks long, and they all have been shown reputable and have made progress with having these implemented into their systems. Another interesting fact is that the CRA, which is the Community Reinvestment Act, is where banks and savings organizations are supposed to reach out to the community and help build them up in these areas. So banks should actually be working with community agencies to build money management programs and other financial programs for the lower socioeconomic community. Another interesting component was credit unions. Credit unions are not like banks. They're not owned and they're not out for profit. They're owned by their members. 19% of credit unions actually offer money management programs to their members. And of credit unions, 30% actually have a remedial money management program in place for the lower socioeconomic community. Lastly, on the money management program, I found it very interesting and brought to my attention that there is an app for iPhones that is very productive for social workers. It's called iExpenseIt, which is a program that helps you to build a budget for, well, yourself, of course, if you want to, and for your clients. Like if you need to go to their home and they can't be at your office for some reason, whether you go to their home or to wherever they are in that location, you can actually use this application to build a budget for them and to help them to learn more about their finances, because sometimes a visual aid, seeing your money in a visual aspect, helps you to understand it a little bit more about where it's going and how to better deal with it. Switching over to the health literacy side of the literature, there was an article by Spears, which is Health Literacy and Nutrition Behaviors Among Low-Income Adults. She talks about how 36% of the people in America have limited health literacy. They are really not able to understand the labels that they are reading if they're reading them. Several of them are not able to read and understand labels on their medications or doctor's orders, or to be able to look at the ingredients in something and see if it's something the doctor's told them to stay away from and things like that. She discusses how it makes them not able to count calories and watch their portions. So it really creates a problem for them when they can't manage that health food scenario. So basically, what she says is to have a healthy diet, we need to teach them how to eat right. And by eating right, especially if you eat lots of fruits and vegetables, your body naturally wants those good things. And when you eat those things, you feel full longer, which leads to you not being as hungry as much. So you eat less, which actually in turn would mean less trips to have to go to the food bank because you don't eat as much food as you did before, because you're eating the right foods nutritiously. So for my method, I used a survey design. For 1 month on Mondays and Wednesdays at the Salvation Army, and during that time, I came in contact with 62 clients who were asked if they would take my survey, which was 8 questions. They were on financial assistance and food. The 8 questions were structured single option answers. 5 of those were dichotomous, meaning yes or no answers. 2 of them were frequency questions, and the final one was an education level to kind of get an idea of, what education level they have. And then after tabulation, all the data was compiled and put into chi-square tests using univariate and bivariate testing. I chose just a few of my charts to show you what I thought was the most important. So in the univariate charts, the first question that I chose was the actual, if the Salvation Army were to have a financial or money management course, would you attend if it was free? And of the recipients who responded, 69.4% said that they would. The second question that I chose was, if the Salvation Army was to offer foods and nutrition course, would you attend? And again, it was a very high percentage, 59.7% said that they would. The last chart is a bivariate chart, which is the combination of 2 questions. First question was, do you read the labels on the foods that you buy? The second question was, do you read the ingredients on the foods that you buy? And in cross-tabulation of these, it showed that 68% do both. Only 13% don't do either, and I think 19% read one or the other. But the 68% says that they're doing both. So it might be that they're reading them, they want to read them, they may not understand them just because they're reading them. So they need education in that area. Other findings were that 84% of the people stated that they make a budget. That was actually one of the questions, do you make one? And 84% said they do. Whether they're making it appropriately, it's not working, or else they wouldn't be coming to the Salvation Army for assistance, so there's something wrong there. 43.5% said they maxed their visits from the Food Distribution Center, which is the Salvation Army's Wednesday food program. 43.5% used the food distribution only when they need it. 25.8% maxed their food vouchers, which is where they come and get the voucher and take it to the food bank. 53.2% have food vouchers only when they need it, and 64.6% have only a high school diploma or a GED. 30.6% only have some college. So it's a very high level of people that are coming that have very low education. The neatness between the 2 of these, I think, is that the food distribution is the Salvation Army's program. The food vouchers are the food bank program. And from what I can tell and how I perceive it, they actually prefer the Salvation Army's program because the food program is more of a client choice-centered distribution. And the food banks is more box program. So, discussions and conclusions. Research has shown improvement with money management programs. A small sample survey show courses could be acceptable because people did say that they would take them of the small sample that was done. So an attempt should be made to incorporate these programs into the Salvation Army's programs that are available to the public. And limitations for my study were the error in my own calculation, maybe in putting in the data and the collection of it. The truthfulness of the respondents and whether they actually make a budget or whether they actually, read labels and whether they actually do those things that I had asked. The other limitation was my sample size. It is kind of small compared to our lower socioeconomic community members, and I only did 64. And then time constraint was also another reason. And that's it. Any questions? Thank you. And I made the screen go black. Okay, how do I get out?
Any questions? Any questions? Go ahead.
I was wondering, you sort of like alluded to that they were there because they weren't budgeting their money well, and was there evidence showing that assistance out there is adequate for people who are in the poverty level? I mean, is there enough assistance in way of link funds or?
I honestly don't feel that because of the way people are, if you're talking about food and why they come to the Salvation Army to get it, when people come to the Salvation Army, they're having to get extra food because they're spending all of their link food voucher money on food, and when that runs out, then they have to come and get some more. I think that happens because they're eating the wrong foods. And when you're eating the wrong foods, you're hungry more often, so you're eating more. So they're eating more food because they're not eating the right foods.
See what I'm saying? It's not so much about their budgeting as much as it is
budgeting
about...
can be an effect too, because a lot of people, if they don't put on paper what's happening and really see it or visually or have somebody telling them about it, money can just kind of fly right out your pocket without even, and you spend $1 here for a soda, you spend $3 here for a meal, and it really adds up when you have a very low income. So sometimes it's them not being able to make the transition with their own self to say, I can't have that meal right now, I can't buy that food out, because I have to eat and this has to go for food for my family, or I can't put, pay $5 to somebody to take me somewhere to do something because I need this for food. So they just make bad financial choices, basically, is all it boils down to, and those bad financial choices also. So the two of them really go together, it's just, the two of them just go together to kind of make it really hard for them to where they have to actually come to get the assistance.
Do you think that some of their poor food choices are based on the fact that might be just perceived as a treat for them because they are so poor that maybe that soda is like the big deal?
They get hooked on it, because soda, I rank soda right up there with cigarettes. It's addictive. I know a lot of people, I don't drink it myself. My husband and I quit like 4 years ago. It's been over 5 years ago. I'm drinking soda completely. I don't eat it at all because it's so bad for you. And it's just as addictive as sugar. You want the sugar and then you crave more, and it's just gets a snowball effect. So those things.
And that's one of the limitations of this, is that you don't have the behavioral component.
Right.
You can pick up a soda, read the label, which majority are saying they're read the label, and understand the ingredients, but still making the choice to grab the soda. And so we don't have a behavioral component in this, which is critical, and of course potential for further study.
And other behavioral things that would include, you don't know if they have a problem or a habit with something else, like gambling or alcohol or whatever. I mean, there are so many different scenarios that are there that we just, you can't take into account because we don't know. They're not going to divulge that kind of information. They're not going to tell you why they don't have that $600 they just got on the check. 3 days later, those things just happen. So, all right, any other questions? Okay.
Thank you.
Thank you.